All right, ladies and gentlemen, it's Dr. Sammy G in the house. I'm back, baby. I am back. So, today's topic is asthma among children. It's a very specific topic and a very interesting topic. Some of you guys are having children or are planning to have children, and unfortunately, some of your children might be dealing with some breathing problems. So that could be, without doubt, asthma. I want to talk about this in today's video. So, what is asthma? Well, the definition of asthma is pretty much an inflammation in the airway causing an obstruction of the airways and thereby difficulties to breathe. That is pretty much what asthma is. And the main reason is, why do children develop asthma? What are the causes? Well, first of all, it could be hereditary. Genes that you're carrying could contribute to asthma. That is the first thing. Number two, you have environmental factors. That is pretty much the main cause of why a lot of children and adults develop asthma. It could be allergies, it could be correlation to physical activities, it could be passive inhalation of smoke, it could be contaminations, allergies to pollen, fur animals, hypersensibility of specific substances, and also cold and warm air. So all of these factors can contribute to an inflammation of the airways and thereby causing an obstruction of the airways, and hence you will have difficulties when it comes to breathing. So what's going on? What's going on, ladies and gentlemen? Why is this happening? Why is this taking place? Well, here's the thing. We're going to talk about the pathophysiology so you can understand what's going on here. You see, when you have asthma, what's going on is you have an inflammation in the airways, and you have inflammatory cells called eosinophil granulocytes, or eosinophiles. They're releasing different substances: histamines, leukotrienes, and prostaglandin. They're all contributing to an obstructing of the airways. The reason why they're causing obstructing of the airways is three reasons. Number one is causing a constriction of the smooth muscle cells in the airway, causing the airways to be more narrow. It gets tight, so the circumference gets tighter. That's the first thing. Second of all, you have an increased mucus, causing the airways to be more blocked and more narrow. And last but not least, you get an edema of the epithelial cells, causing a obstruction and thereby difficulties to breathe. So these three reasons are the main reason why you get an obstruction of the airways and thereby having difficulties to breathe. That's pretty much the pathophysiological mechanism when it comes to asthma. So these factors that are contributing to asthma results in these pathophysiological mechanisms, and hence you develop different types of symptoms. So the next question is, what are the symptoms you may experience as a child if you have asthma? So if you're a parent right now and you notice your child is experiencing these symptoms, this could be an indication that your child might be having asthma. So listen carefully. And if they have these type of problems, you should always come to Dr. Sammy G. And you guys know where I'm at. Like I said, if you need some quick fix, I take cash, baby. I don't take credit, only cash. But what are the symptoms? First of all, you have episodes of heavy breathing. So you may experience heavy breathing, like that's the typical symptoms of asthma. Number two, you may feel and experience a whistling sound when you take deep breaths, whether you breathe in or breathe out. It's like a whistle, like you're gonna hear that, like that's the sound you're gonna hear. Shit, man, I'm so sorry. That's the sound you're gonna hear if you have asthmatic symptoms. That whistling sound when you breathe in or breathe out. All right, now that's not it. What can also happen is that you have frequently coughing problems. You usually frequently cough during the night or during the day. And also, in correlation to different allergies that you might experience, such as pollen, fur animals, or other type of contaminations, when you're exposing to these type of stuff, you can also get these type of asthmatic symptoms like I talked about before. Furthermore, when you're doing exercises, you might be playing football, you're running, doing some basketball, I don't know, any type of physical activity can actually result in asthmatic symptoms. So how do we diagnose this? So how can we confirm that you have asthma? So you might come to me in the primary healthcare, you meet Dr. SammyG, the GP, the family doctor, and you talk about his problems. You are experiencing some difficulties when it comes to breathing as a child, and you as a parent are complaining and get pissed off, you can't sleep, and you tell me, what are we gonna do? What is the problem? Well, here's the thing. Usually when it comes to the symptoms as a child under 5, we pretty much rely on the symptoms and the clinical findings. So if you guys talk about that your child is dealing with problems when it comes to heavy breathing in relation to allergies or activities or even viral infections, and your child is experiencing these type of symptoms that I talked about before, heavy breathing, whistling sound, frequently coughing, that will make me suspect immediately that it could be correlated to asthma, and especially when these symptoms are taking place frequently in these type of situations. That's the first thing. All right, that is usually for children under 5. We usually put the diagnosis when it comes to the clinical findings and the symptoms. And aside from that, when I do my status examination where I listen to the lungs, I will use my stethoscope to listen to the lungs, and I will be able to listen to that whistling sound by just putting the stethoscope on your back or on your child's back, and just put the stethoscope like this on his back. And once he takes that heavy breathing or he breathes in and out, I'll be able to listen to that whistling or wheezing sound, which could also be an indication of asthmatic symptoms. So pretty much clinical findings, my status examination will be able to be enough and sufficient to conclude that the child might be having asthma. And like I said, this is usually for children under 5. When it comes to children from 6 years and older, we're able to do some type of a different type of examination called spirometry. So what is a spirometry? Well, a spirometry is helping us to measure the breathing capacity and the lung capacity. When we use spirometry, we pretty much see how the child is able to breathe properly and measure the capacity when it comes to the lungs. If the child has a reduced breathing capacity and a reduced lung capacity when it comes to breathing, we can conclude with the help of spirometry that the child has asthma. All right, so it helps us to diagnose and conclude the fact that the child, usually above 6 years of age, to have asthma. So that's what it does, spirometry. All right, so the next step, what do we do? What is the treatment? How do we treat your child? You come to me again at the family healthcare, and you meet me, Dr. SammyG, and you say, hey man, do something. I don't have time to deal with this bullshit anymore. I'm tired of my child coughing, having breathing problems 24/7. I go to the emergency, they just inhale with some salbutamol, and then we're done. I send it back to you, and you don't do shit. Do something, motherfucker. I'm sorry, I'm not supposed to swear. But that's usually how the parents act when they see me, because they get so tired when they have these difficulties with their child having these breathing problems. I mean, even if I had a son or a daughter, I'll be also a bit worried and afraid, so. But I'm there, and the first thing I say to them when they act like this, I say, get the fuck out of here, man. No, I'm just joking. I don't say that. Absolutely not. I gotta be professional at work. So the first thing I say is, it sounds tough. It sounds worrying. But you know what? I have a plan. I know exactly what we're gonna do. And when it comes to the treatments, we categorize them in 2 different parts. One part is for the children under 5, and the other one is for the children above 6, or 6 or older. When it comes to the children under 5, it all depends on the level of the symptoms that the child is experiencing. So if you have mild symptoms of asthma, we can start with a medicine called salbutamol. That's one example. So what we do with the salbutamol is pretty much a fast beta agonist, which pretty much means that it's relaxing the airways of the bronchial walls so they could be easier for the child to breathe. Breathe in and breathe out, much easier. It has a fast effect, so it pretty much, the duration of the medicine is 4 hours. So once you feel or experiencing these heavy breathings, you can try that salbutamol and inhale it, and you're gonna feel an improvement immediately. And this is usually for children between 0 and 5. Yeah, they usually need an assistance with a mask as well to inhale the salbutamol. Yeah, so that's the first step. A fast-acting beta-2 agonist with the purpose of relaxing the bronchial walls and thereby reducing the obstruction in the airways. You take it from time to time once you're experiencing these heavy breathing symptoms. Now, sometimes this is not enough. It's not sufficient. And that means you might be experiencing these symptoms more frequently. And thereby the medicine is not able to do its effect. And hence, you need a stronger alternative. And that's why we move on to something called ICS, inhaled corticosteroids. So corticosteroids is pretty much cortisone that helps to reduce the inflammation in the airways once you're dealing with asthmatic problems. It could be budesonide, it could be fluticasone propionate. So these are different types of cortisone inhalations that can help you to reduce the inflammation in the airways and thereby reducing your asthmatic symptoms. You start with a low dose as a child, but sometimes if it doesn't get better or if it's not sufficient, you can increase the dosage to improve the effect of the medicine to reduce the inflammation and thereby reducing the symptoms. Or what you can also do is combine the low dosage of ICS with something called leukotriene antagonist. And like I said before, leukotriene is responsible for contributing to the obstructions of the airways. So when you have a leukotriene antagonist, such as montelukast, it helps to reduce the obstructions and reducing the asthmatic symptoms in combination with the ICS. Now, if this doesn't get better, what we usually do in the primary healthcare is we're writing a referral letter to the pediatricians to help us with further investigations and treatments when it comes to children dealing with asthma. So we pretty much don't do a lot from here. We usually send them to the pediatricians to do the further treatments if it's required. Now that's for children from 0 to 5. When it comes to children from 6 to older, we usually do the same type of treatments as the adults, but with lower dosage. All right. So the first step is pretty much the same thing as for the younger ones. We start with salbutamol, a low dosage of salbutamol when you could take it when needed when you're dealing with different asthmatic problems. Now, if it doesn't get better, we also start with some type of ICS, inhaled corticosteroids, such as budesonide or fluticasone propionate, with the purpose of reducing the inflammation as well. Now, if this doesn't get better, we could increase the dosage of the ICS, and also we can combine it with a leukotriene antagonist, such as montelukast, like I talked before about, or the child can get something called LABA, long-acting beta-2 agonist. A long-acting beta-2 agonist is a long-lasting effect of the beta-2 agonist compared to the fasting ones. These have a duration of 12 hours compared to salbutamol, who only have 4 hours. One example of LABA is salmeterol, which is also a long-acting beta-2 agonist. So we can combine this one or a leukotriene antagonist together with the ICS. Now, if this doesn't get better, what we usually do here as well is we write a referral letter to the pediatricians to take care of the patients for further treatments and investigations. So, ladies and gentlemen, that's it. We are finished. Now you understand about asthmatic problems among children, the main reason behind it, contributing factors, the symptoms, how we diagnose asthma, and how we treat children with asthma in the primary healthcare as a family doctor. This was Dr. Sammy G, ladies and gentlemen, and I'm done. I hope you guys have a great day, and I'll be back with the next video. Peace out. Peace out.